During the hearing, you said to this committee and to the Finance Committee, I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs. That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true.
In one of the sharpest exchanges of the committee hearing, Senator Chris Murphy confronted Secretary Kennedy over what he described as a dangerous breach of trust on vaccine policy. Murphy accused Kennedy of breaking his promises made during confirmation, withholding billions in vaccine-related public health funding, and spreading contested claims that undermine confidence in life-saving immunizations. The clash underscored not just a policy dispute, but a deeper battle over the role of truth, trust, and public health responsibility.
Thank you very much, Madam Chair. Secretary Kennedy, I want to talk to you about your relationship with this committee and this Congress. I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs. That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs. That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said specific to the measles vaccine that you support the measles vaccine, but you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in front of—
Do you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. Senator, begging your progress, you do not know what you're talking about.
For the record—
Let's have a little bit of order so that you can get
Madam
your
Chair,
question
I'm speaking. I didn't ask for a response yet.
I understand.
I'd like to lay out the predicate of my question before I'm interrupted by the witness. He should have some respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you've said about the vaccine, and the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but, you know, the lake is probably toxic, and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. Nobody's going to swim in that lake if that's what you say. And so I want you to acknowledge that when you say you support the measles vaccine and then go out and repeatedly undermine the vaccine with information that is contested by public health experts, that is not supporting the vaccine. And so I guess I have two simple questions for you. One is, can you clarify what you said in the House this morning? Are you or are you not recommending that families get their children vaccinated, or are you just giving people the pros and cons? And do you understand that when you say these things about the measles vaccine, what ends up happening is less people get the vaccine? That may be what you want, but do you understand that the result of constantly questioning the efficacy or safety of the vaccine results in less people getting the vaccine? So I don't necessarily want to spend the remaining 20 seconds in an argument over the science, but do you at least understand that that's the consequence of what you're saying? And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said in...
Doesn't sound like you are, if that's...
Are you going to let me answer? Or are you going to keep interrupting?
Are you or are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have radical transparency. I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine or not?
I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
I think you're answering the question. I think you're
And
answering
the reason
the question. That's
that
really
people-
dangerous for the American public and for families.
The reason people have lost faith in this program is because they've been lied to by public officials for year after year after year.
No longer recommending the measles vaccine.
Senator Marshall.
In one of the sharpest exchanges of the recent Senate committee hearing, Senator Chris Murphy confronted Secretary Kennedy over what he described as a dangerous breach of trust on vaccine policy. Murphy accused Kennedy of breaking promises made during his confirmation, withholding billions in vaccine-related public health funding, and spreading contested claims that undermine confidence in life-saving immunizations. What unfolded was not a routine policy disagreement, but a clash of philosophies over truth, trust, and responsibility, one that could shape the future of public health in America. When Secretary Kennedy came before the committee for his confirmation hearing, vaccines were front and center. Vaccines have long been a cornerstone of public health, credited with eradicating smallpox, nearly eliminating polio, and containing measles and mumps. Aware of past skepticism about his views, Kennedy sought to reassure lawmakers. He pledged not to impound, divert, or otherwise reduce funding appropriated by Congress for vaccination programs. He also vowed that the Food and Drug Administration would not alter its historic standards for vaccine approvals. Those assurances were crucial. They helped him win support from senators, including Chairman Cassidy, who strongly believe in the value of vaccines but wanted to trust Kennedy at his word. Murphy returned to those assurances with a prosecutor's precision. According to him, Kennedy had done precisely the opposite of what he promised. Instead of protecting congressional funding, Kennedy allegedly withheld $12 billion in public health grants. Those grants, Murphy stressed, were not abstract budget lines. They were the funds states used to track immunization rates, administer vaccines, and reach hesitant populations. Without them, state health departments were left weakened, their ability to keep communities safe diminished. For Murphy, this was not merely a broken promise, it was a betrayal of trust with concrete public health consequences. The senator's accusations didn't stop at funding. He charged Kennedy with changing FDA vaccine standards despite his sworn pledge not to. Kennedy's own press release had described the new framework as a radical departure from past practices. Experts warned that the change would delay vaccine approvals, leaving families vulnerable while bureaucratic hurdles piled up. Murphy reminded the committee that Kennedy had personally promised not to alter these standards, only to break that commitment once in office. If the funding and regulatory changes were one half of Murphy's case, the other half was Kennedy's rhetoric, especially on the measles vaccine. Murphy recited a series of Kennedy's public statements, that the vaccine wanes quickly, that it was never fully tested for safety, that it contains fetal debris, and that he would not recommend it for his own children, preferring instead to lay out the pros and cons. To Murphy, this amounted to sabotage. Kennedy had told Congress he supported vaccines, but then went out in public and undermined them with alarming language. The senator illustrated his point with a metaphor. Telling people a lake is safe to swim in while warning that it is toxic and filled with snakes and alligators, he argued, is not real support. It is an invitation to stay away. Likewise, he said, no parent would choose to vaccinate their child after hearing Kennedy's warnings. By presenting contested claims as fact, Murphy contended, Kennedy was not empowering families but discouraging them from protecting their children. Kennedy did not back down. When Murphy listed the statements, Kennedy replied bluntly, all true. He was not retreating or apologizing. Instead, he reframed his approach as honesty. To Kennedy, the problem was not that he undermined vaccines, but that previous officials had oversold them. Public trust, he argued, had already been eroded by officials who withheld inconvenient truths. His mission, as he saw it, was to restore faith by telling the whole story, even if that story included flaws, uncertainties, or risks. He reached for his own metaphor, alligators in a lake. Wouldn't you want someone to warn you if the water you were about to swim in was dangerous? In his view, presenting both the pros and cons of vaccines was not sabotage, but respect. Americans, he said, deserve to know not only what is known, but also what is not known. Glossing over risks, however small or disputed, insulted the public's intelligence. The contrast between the two men's positions could not have been sharper. For Murphy, the duty of a public health leader is to reinforce confidence by aligning with scientific consensus. Vaccines, he stressed, are among the most rigorously studied interventions in medicine. While no product is absolutely risk-free, the evidence overwhelmingly supports their safety and effectiveness. Public statements that suggest otherwise, especially from the nation's top health official, risk discouraging parents, lowering vaccination rates, and triggering preventable outbreaks. For Kennedy, the duty of a public health leader is to tell the truth as he sees it, regardless of the consequences. He sees himself as breaking from a paternalistic tradition in which officials sell vaccines as uniformly safe. Instead, he wants to disclose everything, uncertainties, limitations, even contested claims. To him, this is not recklessness but respect. If fewer people choose to vaccinate in the short term, he argues, the long-term benefit will be greater trust in institutions that finally admit imperfection. The stakes of this divide are enormous. Take measles as an example. The vaccine has prevented millions of deaths worldwide. In the United States, measles was declared eliminated in 2000, yet outbreaks have re-emerged in recent years in communities with low vaccination rates. The Centers for Disease Control and Prevention warns that coverage must stay above 90 to 95% to maintain herd immunity. Even a small dip can spark an outbreak. Murphy's fear is that Kennedy's statements, regardless of his intentions, will cause just such a dip. The likely result, he warned, is more disease and more lives at risk. Kennedy counters that it is precisely the failure to acknowledge risks that has already driven mistrust. He points to the COVID-19 pandemic as evidence, when official assurances sometimes shifted in confusing or contradictory ways. If people suspect they are not being told the full truth, they may reject guidance altogether. For Kennedy, candor is the only way to build long-term confidence, even if it means unsettling parents in the short run. This exchange lays bare the deeper crisis facing American institutions: trust. Public confidence in government, media, and even medicine has declined sharply. The pandemic only accelerated this erosion. In such an environment, the words of a cabinet secretary carry immense weight. Murphy wants those words to be clear endorsements of vaccines, reinforcing consensus and encouraging parents to act. Kennedy wants them to reflect the messy reality of science, trusting the public to decide for themselves. Both approaches carry risks. Too much reassurance risks suspicion if reality falls short. Too much focus on uncertainty risks paralysis and inaction. Murphy also underscored another issue: accountability. cabinet officials do not speak only as private individuals. They are bound by the promises they make during confirmation hearings. By breaking his commitments on funding and FDA standards, Murphy argued, Kennedy had undermined the relationship between Congress and the executive branch itself. "You did not tell the truth," Murphy repeated, a charge as damaging politically as it is substantively. When Murphy pressed Kennedy directly, "Do you recommend families vaccinate their children against measles?" Kennedy never gave a simple yes. He circled back to metaphors, caveats, and appeals to honesty. The evasiveness itself became part of the problem. Senators and the public were left unclear about whether the nation's top health official truly supports the measles vaccine or merely tolerates it as one option among many. Looking ahead, the confrontation raises questions that extend beyond Kennedy's tenure. How should leaders talk about vaccines in an age of polarization? Is it better to emphasize the scientific consensus or to highlight uncertainties? What responsibility do officials have to honor their sworn promises to Congress when their views evolve or diverge once in office? These are not abstract questions. They will shape how Americans understand science, trust their leaders, and respond in future health crises. The immediate fallout is clear. The relationship between Kennedy and key senators has been damaged, perhaps irreparably. Murphy's charge that Kennedy lied to the committee will not be forgotten. Whether Kennedy's philosophy of candor ultimately strengthens or weakens public confidence remains uncertain. But the clash itself has already revealed the fragility of public trust and the difficulty of balancing honesty with responsibility. In the end, the confrontation was not just about one secretary's words or one senator's outrage. It was about the foundation of public health itself. Vaccines work because people believe in them enough to use them. That belief is built or eroded in moments like this, when leaders speak to the public about risk, safety, and science. The Murphy-Kennedy exchange will be remembered as more than a political fight. It was a turning point in the nation's ongoing struggle to reconcile truth, trust, and responsibility in the face of division. The Murphy-Kennedy confrontation exposed more than a disagreement over facts. It revealed a fault line in American governance. Public health depends not only on science and medicine, but also on trust. When promises to Congress and the public are seen as broken, when the nation's leaders blur the line between transparency and fear, the credibility of institutions erodes. For Murphy, the risk is clear: fewer vaccinations, more outbreaks, and lives needlessly endangered. For Kennedy, the mission is to tell the unvarnished truth, even at the cost of confidence. The clash leaves the public caught between two competing visions of responsibility, one rooted in reassurance, the other in skepticism. How that balance plays out may shape the nation's vaccine future for years to come.